Daddy only sleeps when you're here." Sophie caught Claire's sleeve as the nurse reached the door. Claire glanced back at Jack in bed, expecting a nightmare. "I'll check on him again, sweetheart." But Sophie wasn't looking at her father's face. She was watching his chest. In her hand was a plastic watch. Each time Jack breathed, Sophie pressed a button. One breath, another. Claire stopped moving. This child wasn't staying awake because she feared a bad dream. She had made herself responsible for making sure her father kept breathing. 3 hours earlier, Claire Donovan had already learned that room 417 behaved differently after midnight. The monitors stayed steady, the IV pump rarely complained, and Commander Jack Mercer's chart used words like stable and improving. Still, every time the lights dimmed, his 7-year-old daughter sat a little straighter in the recliner. She never relaxed. Claire noticed things because noticing was easier than talking. She checked Jack's chest dressing, traced the oxygen tubing with 2 fingers, confirmed the numbers on the monitor, then moved on without making a production of it. She had never liked people watching her work. Good work should disappear into the room. Jack looked like a man built for motion and forced into stillness. Even half reclined, he filled the narrow hospital bed, shoulders broad beneath the gown, one side of his ribs wrapped and tender from the training accident. The injury was healing. The problem was that sleep seemed to hurt him differently, especially after dark. Sophie sat with a coloring book open across her knees. She had not colored a single thing. Beside her was a paper cup of hot chocolate gone cold. Claire touched it while clearing the tray. "Want me to warm this up?" Sophie shook her head. "I'm not thirsty anymore." The marshmallows had dissolved. Claire glanced at the clock, nearly 1 in the morning. "You asked for it 3 hours ago." Sophie gave her the serious look children use when they suspect an adult is trying to trick them. "I'm not sleepy either." "Convenient," Claire said, and earned the smallest smile from her. Claire let it go. The smile disappeared when Jack shifted under the blanket. Sophie's eyes left Claire immediately. First the monitor, then her father's chest, then the cheap purple watch around her wrist. It happened so quickly most people would have missed it. Claire didn't. She filed it away without asking what it meant. A respiratory therapist came through, checked Jack, called him tough as nails, and told Sophie her dad would be home before she knew it. Sophie nodded politely. The moment he left, she looked at the monitor again. Claire wondered how many adults had reassured the girl without noticing reassurance was no longer reaching her. Jack woke when Claire adjusted the edge of his dressing. His eyes opened fast and went straight past her toward the recliner. "Soph, I'm here." His shoulders loosened. "You should be asleep." Sophie folded her arms. "So should you." Jack almost smiled. "That's different. Because you're old?" Claire nearly laughed. Jack tried to laugh and regretted it immediately, one hand pressing against his ribs. Claire was already checking his breathing. "Easy. Your ribs don't care that your daughter is funny. She gets that from her mother," he said, too casually. The sentence left a quiet space behind it. Sophie did not. Claire didn't step into that space. She adjusted his pillow, checked the line at his wrist, and asked for a pain score. Jack gave her a number lower than the one his face suggested. She wrote down the number he said and remembered the number she believed. That difference mattered. "You can go home," Jack told Sophie later. "Aunt Megan can pick you up." Sophie shook her head. "I'm fine." Another shake. Jack looked toward Claire, silently asking for help. Claire stayed neutral. Sophie had already stopped listening anyway. Her attention was back on the rise and fall beneath his blanket. At 1:30, Claire stepped into the hallway to answer another patient's call light. She was gone less than 4 minutes. When she returned, Sophie was standing beside the bed, coloring book on the floor. Jack's fingers had curled around the sheet and his breathing had turned shallow, quick, almost soundless. Sophie was already watching. His eyes were still closed. Sophie looked at Claire with relief so immediate it hurt to see. "You came back." Claire moved to the bedside as Jack's jaw tightened against something inside the dream. Nothing on the monitor was dangerous yet, but Sophie had already taken hold of her purple watch and started counting. Jack woke hard enough to pull against the bedrail. His breath caught first, then his whole body followed, shoulders locking as his eyes searched a room that had not changed. Claire kept one hand near his forearm without touching him. "Jack, you're in the hospital." "Sophie's right here." His pulse raced. His gaze found his daughter before it found anything else. Sophie was beside the bed, purple watch pressed between both hands. "You okay?" he asked. The question came out rough. Claire almost laughed at the absurdity of it. He was the one sweating through his gown, but he was checking her. She looked terrified. "I'm fine," Sophie said quickly, too quickly. Jack looked at the monitor, then at Claire, as if confirming the room had not witnessed more than he could explain. His face changed when he understood that Sophie had seen everything. The pain was still there. The embarrassment arrived on top of it. Claire noticed both. Claire had seen men hide pain for a dozen reasons: pride, habit, fear of losing control. Jack was doing something different. He was trying to erase the last 2 minutes from his daughter's memory by acting as though they had never happened. "Just a dream," he said. "Bad timing." Claire recognized the difference. Sophie climbed back into the recliner. She did not argue. That worried Claire more than if she had. Jack adjusted the blanket with his good hand and gave his daughter a steady look. "See, I'm okay." Sophie nodded because he needed her to. Then she looked at Claire instead. Jack missed that. Morning rounds brought Dr. Aaron Feld, the trauma attending, and a resident carrying a tablet. Feld reviewed Jack's overnight vitals, asked about the episodes, then recommended a behavioral health consultation before discharge planning. He said it clinically without judgment. Jack's expression still closed, as if someone had quietly locked a door. Claire watched Jack. "I'm already talking to people," Jack said. "My command has resources." Feld nodded. "Good. This isn't about labeling you. Your sleep disruption is affecting recovery, and your daughter is seeing it." That last part landed. Jack's jaw tightened. "My daughter has seen enough without people making her think I'm unstable." Sophie looked down. Feld did not push. No one said unstable. Jack looked at him anyway. She lost her mother. She needs one parent who is still standing. Claire was charting at the foot of the bed, but her pen stopped. There it was. Not contempt for therapy, not denial. Fear dressed as responsibility. Claire understood. "You think pretending she can't see it makes her feel safer?" Claire asked. Jack turned toward her. Feld glanced up, mildly surprised that she had entered the conversation. Claire did not soften the question. She did not sharpen it either. She simply left it where Jack had to look at it. He hated the question. "I think she's 7, Jack said. "I think she deserves a father who doesn't hand her every ugly thing in his head." Claire met his eyes. There was no pity in her face, which seemed to unsettle him more than pity would have. "Then don't hand it to her," she said. Jack waited. Claire continued, "But don't make her responsible for believing you're fine when she already knows you're not sleeping." The room went quiet. Feld did not interrupt. Jack looked toward Sophie. She was pretending to color now, moving a blue crayon across the same small corner of the page. Jack heard it. For the first time since waking, Jack seemed unsure what to say. Claire returned to the medication record, giving him somewhere to put the silence. She had learned long ago that people sometimes heard the truth better when no one stood over them, waiting for a confession. Jack watched her for another second. Later, when Feld and the resident were gone, Claire crouched beside Sophie's recliner and straightened the blanket pooled near her shoes. She kept her voice light. "Can I ask you something?" Sophie nodded. Claire glanced once at Jack, who had finally closed his eyes again. "When do you sleep?" Sophie said nothing. Her fingers tightened. Claire did not ask again. She only watched. Later, she timed her rounds so she would be near room 417 when Jack drifted off. Sophie was curled in the recliner beneath a hospital blanket, eyes half closed, looking for all the world like a child losing a fight with sleep. Then Jack's breathing changed, not dramatically, just enough to become uneven. Sophie's eyes opened at once. She slipped from the chair without making a sound and moved to the bedside. No panic, no hesitation. She looked at his chest, then the monitor, then the purple watch looped around her wrist. Claire stayed near the doorway. Sophie counted under her breath. 1, 2, 3. She watched the blanket rise. When Jack paused too long between breaths, she touched 2 fingers to the back of his hand. His fingers twitched. Sophie waited. When his breathing settled, she returned her attention to the watch. It was not a medical technique. It was not something anyone had taught her in a hospital. It was simply a ritual a frightened child had built from repetition. Watch his chest, count the breaths, touch his hand. Call Claire if he starts moving like the bad dream has found him. Claire understood because rituals like that never appeared overnight. Sophie had practiced this, not once, not for 4 nights in a hospital, long enough for each step to become automatic, long enough that she could perform it while barely awake, long enough that fear had learned how to wear the shape of responsibility. Jack shifted again. His jaw tightened. Sophie leaned closer and whispered, "Daddy." Nothing. She touched his hand. "Daddy, you're here." His breathing quickened instead. Sophie looked toward the door and found Claire immediately. "It's starting." She said it with the calm tone another child might use to announce rain. Claire crossed the room, lowered the lights another notch, and spoke Jack's name until his shoulders eased. She did not praise Sophie for helping. Praising a 7-year-old for being good at managing her father's nightmares felt too much like giving a medal for a job she should never have held. When Jack settled, Sophie climbed back into the recliner. Claire pulled the blanket over her legs. "How long have you been doing that?" Sophie shrugged. "Doing what?" "Counting." The girl looked toward her father before answering. "Since after Mommy died. It got worse when Daddy came home from the last trip." Claire kept her expression still. "Does your dad know?" Sophie shook her head. "He thinks I sleep. Do you?" Sophie considered the question as if accuracy mattered. "Sometimes, when he's awake." Claire felt something cold move through her chest. "And when he sleeps?" Sophie looked at the watch. "I have to listen," she said. "If I sleep too hard, I won't know when he goes somewhere bad." There was no tremble in her voice. That was the worst part. "Where does he go?" Claire asked. Sophie shrugged again. "I don't know. But when he comes back, he looks scared." Claire sat on the edge of the empty visitor chair. "Sophie, it isn't your job to bring him back." The girl frowned, not offended, only confused. "Then whose job is it?" Claire opened her mouth and found she had no answer simple enough for 7 years old. Sophie solved it herself. "Nobody else hears him." Briefly, Claire was somewhere else entirely. Red cabin lights, headsets, a voice counting over rotor noise while exhausted people stayed awake because someone had to. The memory vanished before it formed a face. Claire stood too quickly and told Sophie she would be right back. In the hallway, Claire stopped beside the supply alcove and pressed both palms against the counter until the old feeling passed. She had seen watch rotations before, people forcing themselves awake because somebody else's life depended on it. She had never expected to see one in a child. Through the glass, Sophie was already watching Jack breathe again, small shoulders squared beneath a hospital blanket. Jack needed help sleeping. That was obvious now, but the more urgent truth was quieter and only 7 years old. Sophie needed someone to tell her she could finally stand down. Claire did not tell Sophie she had made a decision. She simply changed how she handled room 417. The television stayed off after midnight. The overhead light went dark. Before touching Jack, Claire told him exactly what she was about to do. Nothing in the room happened without warning if she could help it. The first time Jack noticed, he gave her a tired look. "You always narrate your job?" Claire checked the pulse oximeter. "Only when surprise is making somebody's nervous system work harder than it has to," he almost argued. Then Sophie shifted in the recliner and he let the question go. When his breathing tightened later, Claire did not rush him. "Jack, you're at Hampton Roads Memorial. It's Thursday night. Sophie is asleep 6 feet away. I'm going to touch your wrist now." She waited half a second, then did it. His pulse was fast, but his eyes found the room sooner. Claire kept her voice low. "Don't fight the first breath, just notice it. In for 4, hold for 2, out for 4. Jack followed reluctantly. The way a man follows instructions he intends to criticize later. By the 3rd cycle, his shoulders had lowered. Sophie never woke. Dr. Feld's resident, Melissa Grant, watched from the doorway. "His oxygen is 98%. Heart rate's already coming down." Claire nodded. "I know." Melissa glanced toward Jack. "Then why are you spending 15 minutes managing the room?" Claire looked at Sophie. "Because those numbers aren't the only thing keeping somebody awake." Melissa was not cruel. She was overworked, practical, and trained to trust what could be measured. Behavioral health can handle the rest in the morning. "They should," Claire said, "if he agrees to see them." Melissa's expression made clear she considered that somebody else's problem. Claire considered it the whole problem. Jack heard enough to understand. "I'm not refusing help." Claire turned back to him. "You declined the consult twice. I declined making this bigger than it is." His eyes went to Sophie. "She's had enough people explaining to her that her family is broken." Claire did not correct the word family. "She doesn't need another reason to worry about me." Jack's voice dropped. She needs normal. Claire looked at the little girl sleeping with one sneaker still on, purple watch trapped beneath her palm. She needs permission to stop pretending this is normal. Jack followed her gaze and went very still. For a moment, the room held no rank, no hospital titles, no arguments. Just a father looking at evidence he had tried not to see. "You think a psychiatrist fixes that?" he asked. "No," Claire said. "I think you showing her what getting help looks like might." Jack looked back at Claire. He seemed to expect judgment and found none. That mattered. Pity would have given him something to resist. Claire offered him nothing but a choice. "Sophie doesn't need a father who never gets scared," she said. "She needs a father who knows what to do when he does." Jack swallowed. His eyes returned to Sophie. "One consult." Claire nodded once. "One honest consult. You negotiate like a hostage officer. I negotiate like a night nurse who would like your daughter to sleep before she graduates high school." The corner of his mouth moved despite himself. The consult happened the next afternoon. Claire did not sit in on it. She made that boundary deliberate. When Jack later asked where she had been, she said, "Taking care of my other patients." Something in his expression suggested he had expected her nearby. Something in hers reminded him she could not become part of the treatment. Still, over the next 2 nights, Claire noticed a change. When Jack woke disoriented, his eyes no longer went first to the monitor or the door. They searched for sound. More specifically, they searched for her voice. Claire answered from wherever she happened to be, then stepped back once he knew where he was. Just before 3 in the morning, Jack slipped into a shallow nightmare. Claire dimmed the room, speaking while approaching. "Jack, you're here. Sophie's safe. Stay with my voice." His breath caught. Claire used the cadence again. 4 in, hold 2, 4 out. His body settled almost immediately. Too quickly. Jack's eyes opened, unfocused but searching. He looked at Claire as though he had heard something through a wall years away. "You say 424, he whispered. Claire's hand stopped above the bedrail. "What?" His gaze sharpened by degrees. "That count. You always say 424. Claire lowered her hand. "It's a breathing rhythm. I know what it is." His voice was rough with sleep. "I've heard you do it before." Claire felt the room narrow around that sentence. "Before this hospital?" Jack closed his eyes, trying to catch something that kept slipping away. "Yes." The answer came slowly. "Not you, maybe." The voice. Claire said nothing. 424 was not something she had picked up in nursing school. It had belonged to another life, another uniform, another kind of night where speaking clearly could matter more than having enough light to see. "You're sure?" she asked. Jack gave a humorless breath. "I spent 20 years being paid to notice patterns." He opened his eyes again. "That one I remember." Claire checked the monitor because it gave her somewhere safe to look. Every number was normal. None of them explained the cold feeling under her ribs. A rotor thudded once inside her memory. Red cabin lights. The hard vibration of a medical aircraft pushing through bad weather. Gloved hands braced against a stretcher. A woman's face half hidden beneath an oxygen mask. Claire shut the image down before it could finish becoming a memory. Jack watched her. "Did I say something wrong?" "No." The answer was too quick. Claire adjusted his blanket, though it did not need adjusting. "You're tired. Memory does strange things when sleep is broken." That sounded like something you tell patients when you don't want to answer them. Claire met his eyes. Then it was professionally delivered. He almost smiled, but she was already stepping away. "Try to sleep, Claire." She paused. "Have we met before?" "Not that I remember." This time the truth felt less solid when she said it. She knew the names of the casualties she had flown with well enough to be certain. Jack Mercer had never been on one of her litters. Some names stayed because they survived. Others stayed because they did not. His was nowhere in either list. Yet his certainty bothered her more than confusion would have. For the rest of the shift, Claire found reasons not to linger in room 417. She sent another nurse in with fresh water. She charted from the far station. When Jack needed medication, she gave it efficiently and left before conversation could start. Distance was not fear. That was what she told herself. Jack noticed anyway. "Did I offend you?" he asked the next evening when she checked his dressing. "No. You used to stay long enough to tell me when I was lying about my pain score." Claire taped the fresh gauze into place. "You've improved. Apparently my personality hasn't." Claire looked at him then, the joke covered uncertainty badly. "You didn't do anything. That's not the same as saying nothing changed." He was right, which was inconvenient. Claire capped the saline flush. Sometimes a familiar sound is just a familiar sound, and sometimes it isn't. She had no answer for that. Sophie entered carrying a paper bag from the cafeteria, ending the conversation without knowing she had rescued Claire from it. They had the good cookies. Jack inspected the bag. Those are oatmeal. Exactly. Sophie climbed into the recliner. Mom hated raisins, but Rebecca liked oatmeal cookies. Claire turned too fast. What did you say? Sophie blinked. Jack corrected gently. Your mother's name was Rebecca. You don't have to call her that like she's somebody from a story. Sophie shrugged. Aunt Megan calls her Rebecca sometimes. Claire stood with the blood pressure cuff in her hands, suddenly unable to hear anything but the name. Claire's fingers loosened around the cuff, then tightened again. A name by itself proved nothing, and she knew better than to build certainty from a half-waking memory. Still, the sound of it had reached somewhere medication, exhaustion, and 7 years of forgetting had failed to bury. Jack was watching her. Sophie kept talking about cookies, unaware that one ordinary name had changed the air. Claire finished the blood pressure check. She would not ask questions tonight. Rebecca. The red cabin light returned, brighter this time. Claire had known more than one Rebecca in uniform. That was what she told herself first. Rebecca was common. So were dark hair, stubborn patience, wedding rings taped to swollen fingers, voices asking the same question every 10 minutes because pain and medication kept stealing the answer. But the name had opened a door she had spent years keeping closed. Claire waited until Jack was awake the next afternoon before asking anything. She kept the questions casual enough to leave him room not to answer. Sophie said Rebecca was your wife's name. Jack nodded. Rebecca Hayes professionally, Mercer legally. She kept her name for work. Claire's fingers tightened around the chart tablet. Military? Claire asked. Civilian analyst attached to a joint task group, Jack said. Why? No reason. Claire made herself look at the screen. You mentioned she died after an overseas injury. I was trying to understand Sophie's history. That explanation was true. It simply was not all of the truth. Jack's face softened in the way it always did when Rebecca entered the room through memory. 7 years ago, Eastern Mediterranean assignment. An attack hit the compound she was working from. Claire's pulse seemed to slow instead of speed up. She was evacuated? Yes. First by helicopter, then fixed wing to Germany. Claire heard rotor noise again. A medic shouting over engine vibration. A woman fighting because she wanted to speak. Do you remember when? Claire asked. Jack gave her the month. The exact month. Claire felt one more piece slide into place with a precision she did not want. Sophie was coloring beside them, finally using the book for what it was meant for. I was a baby, she said proudly, as though having once been a baby were an accomplishment. Jack smiled. 8 months old. Claire looked at her. 8 months. The woman on Claire's flight had talked about an 8-month-old daughter. Claire remembered the words without inviting them. My baby has this laugh like she's surprised every time she makes it. She remembered a gloved hand reaching weakly toward a pocket where no photograph remained. She remembered promising to keep talking because silence made the woman more afraid than pain did. Did Rebecca make it to Landstuhl? Claire asked. Jack's eyes narrowed slightly. Yes, he was beginning to notice the specificity. Claire knew it. She stabilized there, then developed complications later. His voice flattened around the old facts. She died after transfer back stateside. Claire nodded because words had become dangerous. She did not look for Rebecca's records. She did not need to, and she had no right to. Everything she knew had come from Jack's own mouth and from a memory Claire had carried privately for 7 years. That made the connection feel more intimate, not less. Jack studied her across the bedrail. Why does Landstuhl mean something to you? Claire chose her answer carefully. I used to work military evacuation. He had known she had served. He had not known much more. You were on flights like hers? Flights like hers, Claire said. Not yet hers. That evening, Sophie asked Claire to braid the loose ribbon on her stuffed rabbit because Jack claimed his hands were trained for other missions. Claire sat beside the recliner and fixed it. Sophie watched seriously. Mom had brown hair. Dad says mine is lighter. Claire's hands paused for half a second. Do you remember her? Claire asked. Sophie shook her head. Not really. I remember pictures. Then, almost cheerfully, Daddy says she talked about me when she was hurt because talking about me made her brave. Claire's throat tightened. That sentence belonged to a place Jack had never been. She finished the ribbon and stood. Jack was watching her now, no longer casually. Claire. She turned. The crew that carried Rebecca out used a breathing count, he said. One of the medics wrote it in the transfer notes. 4 in, 2 held, 4 out. Rebecca repeated it after she came home. The room disappeared. Claire saw red light across a woman's face, heard herself say, "Stay with me." 4 in, hold 2. 4 out again. She remembered Rebecca gripping her glove and whispering about a baby girl waiting at home. There was nothing left to guess. Claire had been on Rebecca Hayes's flight 7 years earlier. Claire waited until Sophie had gone with a volunteer to the children's lounge before she closed the curtain. Jack saw the change in her face before she spoke. He straightened carefully against the pillows, one hand guarding his ribs. "You know something," he said. Claire did not pretend otherwise. "I knew Rebecca." Jack seemed not to understand. Claire set the tablet down so she would have nothing to hold. "Not here, not in Virginia. I was on the evacuation flight that carried her out after she was injured." His face emptied. "You were there?" "For about 6 hours." He looked towards Sophie's empty recliner. 6 hours. For 7 years, Rebecca's final journey had existed in his mind as paperwork, timestamps, and second-hand summaries. Now a living person stood 3 feet away who remembered it. "Was she conscious?" he asked. Claire nodded. "For most of the flight. We kept her stable enough to reach the surgical team. She was alive when we handed her over." Jack closed his eyes. Relief crossed his face so sharply it almost looked like pain. "I knew she reached Germany alive," he said. "But knowing it on paper isn't the same as hearing this." Jack looked at her again. "The breathing count." Claire nodded. "We used it sometimes when the cabin was loud. Something simple to follow when everything else felt out of control." His expression changed. "Rebecca used that count after she came home, only when she couldn't settle. That was enough to make the connection possible without making it mystical." Jack may have heard the rhythm from Rebecca during those weeks, then buried it under grief. Years later, Claire's voice had pulled the pattern back before his conscious mind could remember where it belonged. "So my body remembered something my head didn't." Claire leaned against the counter. "Bodies do that sometimes." He studied her. "You say that like you know." Her expression closed by a fraction. "I've seen it before." Jack let that answer sit between them. Then he asked the question Claire had expected. "Why didn't I know your name?" There was no accusation in it, which somehow made it harder. "If you were beside my wife for 6 hours, why have I spent 7 years not knowing you existed?" "Because medevac crews usually don't become part of the family story," Claire said. "We receive a patient, stabilize, transport, hand off, then move to the next mission. Family notifications and long-term care belong to other teams. I never met you. I didn't know who you were. But you knew she had a husband." "Yes, and a daughter." Claire glanced toward the lounge. "Yes." Jack watched her carefully. "Then she talked to you." It was not really a question. Claire felt the old cabin return around her, red light and engine vibration. She talked when she was awake. Jack's breathing changed, not enough to alarm the monitor, enough for Claire to notice. About what? She could have given him an easy answer. The flight, the pain. Instead, she stayed quiet, and Jack understood that the silence had weight. "Did she know she was badly hurt?" he asked. She knew it was serious. His jaw tightened. "Did she know she might die?" Claire did not answer immediately. She moved one step closer, then stopped before proximity became comfort he had not chosen. "There are things I remember clearly," Claire said. "Things I'd rather tell you carefully than throw at you because this door finally opened." Jack met her eyes. "I've waited 7 years." "I know." Her voice nearly broke, and Jack heard it. Whatever he had been about to ask changed. "You carried something from that flight too, didn't you?" Claire looked toward the window. "More than I meant to." Jack was quiet, then asked, "What did Rebecca say to you?" Claire could hear the engines again. What Claire did not say was that Rebecca's voice had never truly disappeared. It had lived in fragments. A joke beneath engine noise, a hand tightening around hers, a request spoken carefully because there might not be another chance. Claire had carried those fragments without knowing where they belonged. She drew a slow breath. "If you want the whole answer, I need to tell you what those 6 hours were actually like." Jack settled back against the pillows, bracing himself as if the answer might hurt more than the injury. He did not blink. "Then tell me." 7 years earlier, Claire met Rebecca Hayes under red cabin lights and the hammer of engines. There was no proper introduction. Rebecca arrived on a litter with blood darkening the bandage along her side, oxygen tubing under her nose, and one gloved hand refusing to stay still. Claire remembered the noise first. Medical aircraft were never quiet, but that night the engines filled every space where fear might speak. Rebecca kept asking how long until Germany. Claire kept giving her the newest estimate, even when only minutes had changed. The answer mattered less than certainty. 4 hours? Rebecca asked again. Closer to 3.5 now. You said that 10 minutes ago. Then you're good at keeping track. Rebecca almost smiled. It cost her. Claire adjusted the blanket and watched the monitor. Save your energy. Rebecca shook her head. Talking is my energy. When turbulence rolled through the cabin, Rebecca's breathing became quick and shallow. Claire leaned close enough to be heard. Stay with me. 4 in. Hold 2. 4 out. Rebecca followed the count badly at first, then better. Claire repeated it until the panic loosened and the numbers settled. Rebecca asked about home whenever medication blurred the edges of the flight. Not the house, not the weather, a baby. 8 months old. Sophie. She described the ridiculous amount of hair Sophie had been born with and the laugh that appeared whenever someone sneezed. Claire remembered that laugh without hearing it. She won't remember me if something happens, Rebecca said once. Claire corrected her automatically. You're going to surgical care. Stay with what we know. Rebecca gave her a tired look. That wasn't what I said. Claire had no answer, because patients sometimes asked questions medicine could not honestly solve. Rebecca kept talking anyway. She wanted Sophie to know she had hated mashed peas, loved bath time, and slept with both fists beside her face. Details too small for an official record. Claire understood what Rebecca was doing before she admitted it. She was leaving pieces of herself somewhere another person might remember. At one point, Rebecca reached for Claire's wrist. Her grip was weak but deliberate. My husband's name is Jack. Claire nodded. Okay, if there's ever a way to tell him something for me. Her voice faded under the engines. Claire leaned closer. Rebecca said the rest into the space between them. Claire remembered every word. She had spent years wishing she did not because the message was cruel, but because promises become heavy when there is nowhere to deliver them. At the time, Claire told Rebecca she would remember. It was the simplest promise in the world to make at 30,000 feet. They reached Germany with Rebecca alive. That fact mattered. Claire transferred care to the surgical team with numbers that were fragile but survivable, watched the litter disappear through bright doors, and returned to the aircraft because another mission was already waiting. That was how the work continued. For months, Claire told herself the handoff meant her part had ended correctly. Rebecca had reached surgeons. Claire had done what she was trained to do. She did not learn about the later complications until much later, through indirect information that arrived after everyone involved had already moved on. Another flight eventually became the one people assumed had broken Claire. Different patient, different country. Her own medevac partner beside her, injured during extraction, conscious until he wasn't. That time, Claire did everything right and still returned without the person who had spent years occupying the seat across from hers. Afterward, the two memories began bleeding together. Rebecca, delivered alive and lost later. Her partner never delivered alive at all. Claire knew they were different outcomes, different responsibilities, different griefs. Trauma did not care about tidy categories. It stacked every name beneath the same question. What should I have done differently? Back in room 417, Claire finished with only the parts Jack needed first. Rebecca had joked, argued, complained about the oxygen tubing, and talked about Sophie until the crew could have drawn the nursery from memory. Jack listened without moving, as if any motion might disturb the past. She sounds like herself, he said finally. It was the smallest sentence Claire had heard from him, and somehow the most vulnerable. She was, Claire said, injured, medicated, frightened sometimes, but herself. Jack looked down at his hands before asking the question he had carried for 7 years. Was she scared? Claire did not answer immediately. Jack looked up, and whatever he saw in her face made him stop breathing for half a beat. She pulled the visitor chair closer but did not sit until he nodded. Some truths were too heavy to deliver while standing over someone. Yes, Claire said. She was scared. Jack's eyes closed. Claire continued before fear could fill in the rest. But not the way you think. She wasn't alone. She knew where we were taking her. She knew people were working on her, and when she was awake, she kept talking. About us? Jack asked. Mostly Sophie. Claire almost smiled. You came second. A broken laugh escaped him. That sounds right. For a moment, Rebecca was no longer only a death certificate or a photograph on a dresser. She was present again in the way Jack remembered her. She described Sophie like she was afraid the universe might forget details, Claire said. The hair, the laugh, the way she slept. Jack stared at the blanket. I used to imagine Rebecca calling for us, and nobody knowing who we were. Claire leaned forward. She wasn't calling into an empty room. When she needed a hand, she had one. When she needed somebody to hear her, I heard her. I can't change what happened after we landed. But you need to stop imagining she went through those hours alone. Something in Jack's face finally gave way. He turned toward the window, jaw clenched, tears gathering despite the effort to contain them. Claire did not tell him it was okay to cry. She did not touch him. She simply stayed, offering the same thing she had given Rebecca years earlier, presence, without demanding anything in return. After a while, Jack said, "There was more." Claire nodded. "The thing she asked you to tell me." For 7 years, Claire had carried the message without an address. Now the man it belonged to sat 3 feet away, waiting for words his wife had trusted to a stranger. Rebecca said she wasn't most afraid of dying, Claire began. Jack flinched but did not stop her. She was afraid you would turn whatever happened into another mission. Something to endure, something to survive by locking every door inside yourself and calling that strength. Claire's voice softened. She said Sophie needed a father who would live, not just remain alive. She wanted you to laugh without feeling guilty, sleep without standing guard in your own head, ask for help when you needed it, and let your daughter know you were still a person. Jack covered his mouth with one hand. Claire looked away enough to give him privacy. Those aren't her exact words, she said, but that was the promise. Loving her was never supposed to become a punishment you served afterward. Jack whispered, I did exactly what she was afraid I'd do. You survived the way you knew how, Claire said. For 7 years, Jack answered. Then, quieter, I should have heard this years ago. Claire absorbed the words. I had a first name and a family somewhere stateside, no authority to chase private records. Eventually, I convinced myself the message had expired. It didn't expire. Jack looked directly at her. You carried it 7 years. Late isn't the same as failed. The sentence struck somewhere Claire kept armored. Another face flashed through her mind, another flight, another person she had not brought home. She looked down before Jack could see too much. Sophie returned wearing a paper crown and stopped when she saw her father's face. Daddy? Jack wiped his cheek. Come here. He drew her close. Claire knew Mom when you were a baby. Sophie's eyes widened. Mom talked about you. She knew you were loved. She wanted you to know that. Sophie leaned against him without asking for more. Jack held her with his eyes closed. Claire watched a father finally allow someone else to carry part of the weight he had guarded alone. Later, he told Dr. Feld he wanted behavioral health follow-up arranged before discharge. No delaying it, no pretending. Near midnight, Sophie curled beneath the hospital blanket. She checked the monitor once, then looked at Claire. You'll wake me if something happens? Claire nodded. If something happens, the adults will handle it. Sophie considered that, closed her eyes, and for the first time let her father fall asleep before she did. The next evening was the quietest room 417 had been since Jack arrived. Not silent. Hospitals were never silent. Pumps clicked, carts rolled, shoes whispered past the door. But for the first time, Sophie slept through all of it, curled beneath a blanket with her purple watch forgotten on the floor. Jack noticed before anyone said anything. Every time the monitor changed tone, his eyes moved towards Sophie automatically. She did not stir. No small hand reached for the watch. No frightened face checked his chest. Jack stared at her for a long time, and Claire let him. Dr. Lena Morales from Behavioral Health had spent nearly an hour with him that afternoon. She talked about trauma without making it sound like weakness, sleep without pretending nightmares were simple, and recovery without promising anything fast. Jack listened differently than he had listened to Dr. Feld 2 days earlier. There would be follow-up after discharge, a structured sleep plan, trauma-informed therapy, and someone Sophie could talk to who understood what happened when children quietly became caregivers. Claire had arranged none of it herself. She had only helped Jack stay in the room long enough to hear what the specialists were offering. When Claire checked his vitals, Jack nodded towards Sophie. "How long has she been out?" "Almost 3 hours." His expression tightened. "3?" Claire nodded. "She's missed some practice." He looked at his daughter again. "I thought keeping this away from her was protecting her." Claire adjusted the pulse oximeter. "You were protecting her the way you knew how. Badly? That isn't the same thing." Jack gave her a skeptical look. Claire added, "The useful question is what you do next." His eyes returned to Sophie. "How do I make sure she never has to take care of me like that again?" Claire heard the change immediately. 3 days earlier he had wanted instructions for hiding the problem. Now he wanted instructions for removing the burden from his child. "You don't promise her it'll never happen," Claire said. "You build enough support that when it does, she knows it belongs to the adults." Jack nodded slowly. Then, after a silence, "You're very good at saying things people don't want to hear. Occupational hazard. Military or nursing?" Claire looked at the medication scanner. "Both, probably." Jack watched her longer than the answer required. "Who tells you things you don't want to hear?" he asked. Claire scanned the medication. "Pharmacy. Frequently. That's not what I meant." "I know." She handed him the cup. "Take these." Jack obeyed, but his attention remained on her. "You have nightmares too." It was not a question. Claire's expression barely moved. "Most people dream." That wasn't an answer. "You're recovering from chest trauma. Your concern should be breathing, not interrogating your nurse." Jack almost smiled. "Deflection. You taught me to recognize that." Claire checked his monitor and changed the subject with professional efficiency. The numbers were mostly reassuring. Oxygen saturation sat a little lower than earlier but still within acceptable range. Jack's respiratory rate had edged upward. Nothing dramatic, nothing that would justify an alarm by itself. Claire asked whether his pain had changed. He hesitated just long enough for her to notice. "More pressure than pain," he said. "Where?" He touched the injured side of his chest, deeper. "Could be from lying here too long." Claire listened to his lungs carefully. The difference was subtle enough that another person might have called it positioning. She documented it and asked him to sit slightly higher. "You worried?" Jack asked. "I'm paying attention." "That means yes. That means I'm paying attention." She checked his blood pressure again. Still acceptable. The second reading was a little lower than the first. Not dangerous. Not yet. Claire wrote it down instead of explaining it away. An hour passed. Sophie slept through another set of vital signs. Jack eventually closed his eyes too. Claire finished the medication round, updated the incoming nurse, and walked toward the elevator with her bag over one shoulder. Her shift was over. For once, room 417 seemed to have found peace. The elevator doors opened. Claire stepped forward, then stopped. Lower oxygen. Faster breathing. Deeper pressure. Slightly softer breath sounds on the injured side. None of it alone was enough to frighten her. Together, the pattern pulled at something older than conscious thought. She turned around before the elevator doors closed. By the time Claire reached room 417, Jack was awake and sitting higher in the bed. One hand gripped the rail. The other pressed against his injured side. His breathing was faster now, shallow enough that each breath seemed unfinished. Sophie was still asleep in the recliner. "Jack." Claire crossed the room. "Look at me." His face had gone pale. "Something changed, I know." She checked his oxygen level. It had dropped again. Blood pressure lower, heart rate climbing. Claire listened to his chest and heard markedly less air movement on the injured side. She hit the rapid response button. "I need trauma in 417 now. Recent chest injury, worsening dyspnea, falling pressure, decreased breath sounds on the right." The night nurse appeared at the door. Claire pointed toward Sophie. "Keep her back, but don't take her away unless she wants to go." Jack's eyes flicked toward his daughter. "Don't wake her. That decision may be out of our hands." Claire raised the head of the bed and applied oxygen. "Stay with me. Don't chase the breath. Let me know if the pressure gets sharper." Jack nodded, but his attention was already beginning to fragment. Sophie woke when the overhead light came on. She sat upright and reached instinctively for the purple watch. It was not on her wrist. Panic flashed across her face. Then she saw Claire, 2 nurses, respiratory therapy, and the rapid response cart entering the room. For 1 second, Sophie looked ready to climb from the chair and resume the job she had assigned herself. Claire caught her eyes. "Stay right there, sweetheart. We've got him." Sophie froze. Around her, adults moved with purpose. Nobody told her to count. Nobody needed her to watch the monitor. Dr. Feld entered with Melissa Grant behind him. Claire delivered the brief without wasting a word. Increasing respiratory distress over roughly 2 hours. Oxygen down from baseline, pressure trending down, tachycardic right-sided breath sounds now significantly reduced. Chest pressure changed before the vital signs did. Melissa moved the ultrasound into position. Feld listened once, then looked at Claire. "You think expanding pneumothorax? That's my concern." Earlier in the week, he might have asked for 3 more numbers before acting. Tonight, he looked at the monitor, looked at Jack, and made the decision. "I trust your read. Call it." The room accelerated. Feld directed the team while respiratory therapy supported Jack's breathing, and Melissa prepared equipment. Claire stayed where Jack could see her. She told him before each person touched him, the same way she had from the beginning. "They're treating the pressure. Stay with my voice." Jack's breathing shortened further. Claire lowered her voice rather than raising it. "You're in room 417. Sophie is safe. Dr. Feld is right here. 4 in if you can. Hold 2. 4 out." His eyes found hers through the movement surrounding the bed. Feld performed the emergency decompression. The change was not cinematic. There was no miraculous silence. There was simply a gradual shift in the room's arithmetic. Jack's oxygen stopped falling. His blood pressure steadied. Air moved better. The panic in his face loosened enough for him to recognize Sophie again. A chest tube and further imaging would follow under the trauma team's care. Claire did not perform the procedure. She did not need to. She had recognized what was changing before the monitor told the whole story, called the right people, and stayed useful without confusing usefulness with being the only person capable. Sophie watched Dr. Feld, Melissa, respiratory therapy, 2 nurses, and Claire work around her father. The lesson landed without anyone explaining it. Her father did not stay alive because one 7-year-old remained awake. There were people whose job was to notice, respond, and call for more help when they needed it. When Jack finally stabilized, Feld pulled off his gloves and looked at Claire. "Good catch." Claire nodded once, that was all. No speech, no vindication. The monitor mattered more than being right. Jack mattered more than who received credit for noticing first. Sophie approached only after the team said she could. Jack lifted one tired hand. She took it. "I forgot my watch," she whispered. Jack looked at the adults still clearing equipment around him. "Looks like they managed." Sophie glanced around the room and cautiously believed him. Hours later, after imaging confirmed the problem had been controlled and Jack was stable again, Claire stepped into the empty family waiting area. Her shift had ended long ago. The crisis was over. Only then did her hands begin to shake. She pressed them between her knees and waited. Jack saw the shaking before Claire realized anyone was watching. He had been transferred back from imaging, exhausted but stable, and could see through the partially opened doorway of the waiting area from his bed. Claire sat alone under fluorescent light, shoulders still, hands betraying everything the rest of her refused to show. When she returned to check on the handoff, Jack looked at her fingers. "You're shaking." Claire picked up the chart, adrenaline. "You weren't shaking when my oxygen was dropping. That's generally when shaking is least useful." Jack studied her. "So you save it for afterward." Claire did not answer. Sophie was asleep again, this time stretched across the recliner so deeply that one sock had slipped halfway off. Jack lowered his voice. "You recognize that pattern because it's yours." Claire's attention stayed on the screen. "You're getting very observant for someone on pain medication. You stay controlled until everybody else is safe," Jack continued. "Then you disappear somewhere. Nobody can see what it cost." Claire finally looked at him. There was no accusation in his face, no triumph at having figured her out, just recognition. That made it harder to dismiss. "You should sleep," she said. "You should stop telling me what I should do every time I ask about you. Patient care is literally the arrangement here." Jack glanced at the IV, then back at her. "Fine. Clinically, is refusing help good for long-term recovery?" Claire's jaw tightened. "That's cheap. Probably." His voice softened. "Still true." Claire set the chart down. For several seconds, she seemed to decide whether silence was safer. Then she pulled the visitor chair away from the bed rail, rather than closer, a deliberate reminder to both of them of where the boundary remained. "My medevac partner's name was Daniel Reeve," she said. Jack did not move. Claire continued because stopping would make beginning again impossible. We flew together for years. He was better at talking to frightened patients than I was, better at making terrible coffee, worse at following his own advice. Daniel had been injured during an extraction. Claire still remembered in fragments sharper than photographs. She had treated him while the aircraft climbed, called ahead, managed every problem she could reach. She had done the job correctly. None of that changed the fact that he died before they reached the surgical team. I kept thinking there had to be one decision, Claire said. One minute where I chose wrong. Because if there was a wrong choice, then at least the world still made sense. I could learn it and never lose anyone that way again. Jack listened without interrupting. There wasn't one, she said. That was worse. She looked toward Sophie. Rebecca reached surgery alive. Daniel didn't. For a long time my head treated both things like evidence. One person I handed over and later lost. One person I couldn't hand over at all. Different stories. Same verdict. What verdict? Jack asked. Claire gave a small, tired smile. That if I had been better, somebody would still be here. Jack looked at her for a long moment. You know that's not how this works. Claire almost laughed. Interesting hearing that from you. I didn't say I was good at believing it. That pulled a real smile from her, brief and unwilling. My husband tried, Claire said. It was the first time she had mentioned him. He wanted dinners, weekends, a life that wasn't built around my next shift, and I didn't know what to do with someone loving me when he didn't need me to fix anything. She folded her hands to stop the tremor. At work, usefulness had rules. Somebody was bleeding, you stopped it. Somebody couldn't breathe, you called the right people. Marriage didn't work like that. Grief didn't either. Eventually, he got tired of living with someone who only knew how to stay when there was an emergency. Jack's face tightened, not with judgment. So you left. Eventually, because he didn't need saving. Claire stared at him, because I didn't know who I was when nobody did. The truth sounded simpler out loud than it had felt while destroying a marriage. Jack leaned back carefully. You told me Sophie doesn't need a father who never gets scared. She needs a father who knows what to do when he does. Claire looked away. I remember. Then maybe competence isn't pretending you can carry everything alone. Jack, I'm not trying to fix you. That stopped her. He continued. I'm not qualified, remember? The faintest humor entered his voice. I'm saying what you said to me. Getting help doesn't erase what you know how to do. Claire's eyes returned to his. Something shifted there, quiet enough that neither of them named it. Not romance yet. Not permission. Just the unsettling intimacy of being seen accurately by someone she had spent days learning to see. She stood, You're still my patient. I know, and I'm still going to tell you to sleep. I assumed there was a catch. Claire reached the door. Jack said her name. She turned. Daniel dying wasn't proof you failed him. Claire did not answer, but she did not leave immediately either. Sophie woke 20 minutes later with a startled gasp. She sat upright, eyes wild, and grabbed for the watch that still was not there. Daddy, Jack turned toward her. Right here. She rushed to the bed. I fell asleep? I didn't check. Jack reached for her hand. Good. Sophie frowned. Good? You slept. His voice shook more than Claire had heard all week. That's your job. But what if something happens? Jack looked around the room. Claire by the door, the nurse at the station. Dr. Feld's orders on the chart. A whole system of adults Sophie had finally seen working when it mattered. Then I tell someone, Jack said. Or they notice, or we ask for help. But you don't stay awake to keep me alive anymore. Sophie's face crumpled for half a second, not from sadness, but from the strange relief of being released from a responsibility she had believed was permanent. Jack opened his arm carefully. She climbed against his uninjured side. That was never your job, he whispered. Claire looked away to give them privacy, but not before Jack saw the expression on her face. Sophie had finally been told she could stop standing guard. Claire, he suspected, had not yet learned the same thing. 8 months did not heal Jack Mercer. Healing, Claire had learned, was rarely polite. It did not arrive on schedule, close every wound, and leave behind a cleaner person. It came in smaller things, repeated until the body finally believed them when nobody was watching. Jack kept every behavioral health appointment. Some weeks were better than others. He learned to recognize when exhaustion made ordinary sounds feel dangerous, when crowded rooms tightened his chest, and when silence became its own kind of trigger. Knowing the pattern did not erase it. It gave him choices. At home, those choices became routine. He practiced grounding before sleep instead of waiting for panic to force it on him. He kept a lamp on low, left the bedroom door cracked, and stopped, pretending bad nights had not happened by breakfast. Sophie noticed the difference before he did. The first week home, Sophie still appeared in his doorway after midnight. She would stand there quietly, pretending she needed water. Jack stopped sending her back with false reassurance. He would say, "I had a rough minute. I handled it. You can go sleep." Eventually, she believed him enough to leave. Her purple watch disappeared from the nightstand. Then Claire heard, through a mutual veteran support coordinator, that Sophie had joined an after-school running club. The same watch once used to count her father's breaths now timed laps around a school track. Claire kept that detail longer than she meant to. Sophie also started seeing a child therapist who understood families shaped by trauma and loss. Nobody treated her like a patient who needed fixing. She was 7. She needed language for fear, adults who kept promises, and permission to be annoyed when her father burned pancakes or forgot picture day. Claire's progress was quieter. She stayed at Hampton Roads Memorial, still worked trauma nights, still noticed things before most people said them out loud. But she stopped volunteering for every overtime shift. The first evening she went home before midnight, with no emergency waiting, the silence in her apartment felt almost hostile. She stood outside a therapist's office for 6 minutes before going in. The irony was not lost on her. She had watched Jack treat a consultation like surrender. Now her own hand rested on a doorknob while every instinct offered a reason to leave. She went in anyway. Claire finally said Daniel's name in a room where nobody needed her to make the story useful. She talked about the flight, the decisions, the marriage that had slowly collapsed afterward, and the strange belief that grief became acceptable only when converted into work. Nobody congratulated her for surviving it. That was part of what helped. Therapy did not reward her for being strong. It asked what strength had cost her. Some answers made her angry. Some made her tired. Some made her realize she had spent years treating memory like a duty station she was never allowed to leave. She also began showing up at veteran community events again. At first, she stayed near the exits. Then she volunteered at a medical tent for a family day, drank terrible coffee with former medics, and laughed at a story Daniel would have hated. The laugh hurt. Then it passed without becoming betrayal. She did not contact Jack. Jack did not contact her. There were practical reasons, professional reasons, and one emotional reason neither of them needed explained. Whatever had happened in room 417 had been real, but Jack had been vulnerable, dependent on her care, and still learning how to stand without leaning. So 8 months passed with no secret messages, no late-night confessions, no romance disguised as gratitude. Claire sometimes wondered how Sophie was doing. Jack sometimes remembered Claire's voice on difficult nights. Neither treated memory like permission. They let distance do what distance was supposed to do. By early spring, Claire could sleep through more nights than she could not. Jack could wake from a nightmare and orient himself without searching for another person's voice. Sophie could hear her father shift in bed and keep dreaming. None of them were cured. All of them were freer. On a Friday afternoon, a flyer appeared in the hospital break room for a veterans charity run along the Virginia Beach oceanfront. Claire almost ignored it. Then she saw the registration deadline, thought about the purple watch timing laps instead of breaths, and signed her name before she could change her mind. She chose the 5-kilometer route, not because she was competitive, but because finishing something ordinary sounded strangely appealing. No uniform, no trauma bay, no one bleeding. Just a starting line, salt air, and a reason to move forward because she wanted to. She had no idea who else had registered. The morning of the run arrived cold enough to sharpen the ocean air. Claire wore a gray race shirt, black leggings, and no hospital badge. For once, nobody knew her as the woman with an answer. She was simply another participant pinning on a number. She had just finished stretching when a child's voice cut through the crowd. "Claire!" Sophie came running between folding tables, ponytail bouncing, cheeks pink from the cold. Claire barely had time to stand before Sophie wrapped both arms around her waist and nearly knocked her backward. The first thing Claire noticed was the breathing. Not because anything was wrong, because nothing was. Sophie was laughing, winded from running, trying to talk before she had enough air. The girl who once counted every rise of her father's chest was no longer counting at all. "You're here," Sophie said. "I'm doing the kids' mile." She held up the purple watch. "I can do 9 minutes if Dad doesn't make me start too fast." Claire stared at the watch for half a second. Sophie misread the look. "It still works. I changed the battery." Then Jack appeared behind her carrying 2 paper cups and looking like a man who had learned patience the expensive way. He was stronger, leaner, moving without the guarded stiffness Claire remembered. A scar disappeared beneath his collar. He looked healthy. More important, he looked present. He stopped when he saw Claire. For a moment, neither spoke. The hospital had always given them something to do with their hands. Check a line, adjust a blanket, read a monitor. Here there was only wind, coffee, and 8 months of distance between them. "Sophie has been asking when we'd see you again," Jack said. Claire looked at him. "And you?" His eyes held hers. "I was trying to wait until I was asking because I wanted to, not because I needed saving." The answer landed softly, which was why it mattered. Claire glanced toward Sophie, who was pretending to inspect her race number while listening to every word. "That sounds suspiciously healthy." Jack smiled. "Therapy ruined my best defenses. Tragic. I'm learning to live with it." The ease between them surprised Claire more than any confession could have. A whistle called runners toward the start. Sophie grabbed Claire's hand. "Watch me finish. Not stay with Dad. Not make sure he sleeps. Not promise nothing bad will happen. Just watch me finish." Claire felt the meaning of that request more deeply than Sophie could possibly know. The kids' mile started first. Sophie sprinted too fast, exactly as Jack predicted. Halfway down the course she slowed, checked the purple watch, and laughed when Jack shouted about pacing. Claire laughed too. The watch had become what it should have been all along, a child's cheap stopwatch. After Sophie finished, red-faced and triumphant, Claire lined up for the 5-kilometer route. The first mile felt easy. The second reminded her that hospital corridors were not training. Near the final stretch, she heard Sophie yelling from the barrier. "Come on, Claire. You're slowing down." Claire laughed despite herself and tried to settle her breathing. 4 in, hold 2, 4 out. The old cadence came automatically. For years it had belonged to aircraft cabins, wounded bodies, and nights when survival depended on staying present. Now it belonged to tired legs and ocean wind. Sophie ran along the barrier for several yards, ruining the rhythm completely. "Faster!" Claire lost the count and started laughing too hard to recover it. She crossed the finish line, breathless and happy. Nothing terrible happened because she had lost the cadence. That felt like its own victory. Later, the 3 of them stood near the coffee truck while volunteers packed up signs. Jack shifted his cup from one hand to the other. "There's a place 2 blocks from here that serves breakfast all day." Claire raised an eyebrow. "Is this a medical recommendation?" "Absolutely not." "Good," she said. "I'm off duty." Jack took a breath that had nothing to do with grounding. "Would you have breakfast with me?" Claire looked at Sophie, then back at him. She did not promise forever. She did not need to know what this became before allowing it to begin. "1 breakfast," Claire said. Jack smiled. "1 breakfast." Sophie groaned. "Can I come?" Claire laughed. "Today, yes." Jack looked offended. "I was planning to invite my own daughter." "You were taking too long." Sophie grabbed both their hands and started toward the boardwalk together now. And somewhere between the ocean, the finish line, and 1 breakfast, 3 people who had learned how to survive began learning something gentler. How to choose a life when nobody needed saving. If this story stayed with you, share it with someone learning they can finally stand down.